Well, good afternoon and welcome everybody back to our Department of Labor and Economic Opportunity webinar series where we're focusing on workplace mental health. I'm Sean Egan, I'm the Deputy Director for Labor here, and I've been working on this initiative for over a year now and very happy with the progress we've been making and the tools that we're providing, and we're going to continue to develop those and come up with new concepts. There is a Q&A box at the top of your screen, maybe at the bottom for some, where you can submit questions anytime we're going through the information today. We'll get to as many as we can at the end, and we appreciate you submitting those. If you haven't already, please make sure you sign up for our emails on our michigan.gov/workplace mental health page. We send out a lot of information from there, including invites to these webinars and reminders to make sure that you have a chance to participate. And you can find all of the links to our previous webinars on that page as well. We do send out and are working on an update to our report we issued last June on workplace mental health. And we're going to get that out soon, and that's going to go out through that email link as well. So please make sure you get on there. For those of you just joining us for the first time, we kicked off this webinar series in January. We have a great lineup through the end of the year, including today. And we try to do those on the third Thursday of each month at 2 p.m. for about a half an hour. Barring whatever the speaker needs, because as I've shared before, it's really about quality, not quantity, and we want to make sure we're getting out the right information and having the right guests. We're also going to have a couple of additional webinars into addition to our regular series with some cool topics that we've recently unearthed, where we're going to talk about technology and the technology we use in our workplaces and how that impacts us in ways we can better manage that, and then a new program from the Great Lakes Bay Regional Partnership on mental health first aid in the workplace, so that we can better recognize when somebody's struggling or having those challenges. So we're getting those on the books. Keep your eyes on your inbox, and we'll make sure we get that information out when they're available, but that'll be in addition to our regular webinar series. And with all of these webinars, our goal is really to provide working people and employers with information about issues impacting our workplaces that impacts our mental health and options for addressing those issues. And as I mentioned before, as we continue to develop this work, we really see these three focus pillars developing, where we're talking about things that are happening in the workplace itself. So that could be excessive overtime, understaffing, job insecurity, financial insecurity, things that the workplace might be exacerbating some challenges for people. Things affecting the workplace, we'll talk a bit about some of that today, like adverse childhood experiences, racism, poverty, other challenges that people have faced that they're gonna bring with them throughout their lifetime, as well as a couple of months ago, and some you'll hear about today too, trauma can be experienced in the workplace, and that's going to have an impact on how people respond to that type of stress. And then those individual behavioral health supports. We know that we can do a lot of this great work, but we really need to, as individuals, make sure that we're participating in our own health, and that we're providing those tools for people to participate in their own health and development. So we presented a lot of data in our report. We've been on these webinars, and the scale of this challenge at times can feel overwhelming. But we can tackle this challenge, and we will. I think we have to take time and pause every once in a while to think about the positive things that are happening. One of those is we're talking about this. All of you today are helping us talk about this and communicate this message, to let people know that they're not alone, that we have these challenges. All of us, every single day, all of us are having challenges we're encountering that can push us into a position where we're not able to move forward, and we might need some help, and that's okay. It's okay to not feel okay. You're not alone, and we're going to get through this together. Our guest today, really excited to have back. It's wonderful to be able to say that. Vickie Choitz with the Corporation for a Skilled Workforce is not only presenting with you all today, she presented with me when we released our report. And at that time, she really walked through the concept of brain science and how we're all wired to respond to stress the same way, recognizing we might have different stimulus that cause us to have that stress response. But once that's triggered, we're going to have pretty much the same sort of event that's going to happen to us. Vickie is a recognized expert in the field of trauma and a lot of other things, and really helped us develop the report that we do. She's a recognized expert across the country, and we're just thrilled to have her back on our webinar series today. So Vickie, thank you so much for joining us again, and I'll turn it over to you.
Okay, great. Thanks, Sean. It's great to be here. I am excited to talk a little bit with you about how trauma shows up in the workplace. and just wanted to share a little bit with you about Corporation for a Skilled Workforce. So we are a Michigan-based nonprofit national organization, and we focus on workforce development and economic development and helping communities and organizations succeed. Our Trauma and Resilience at Work team advances workplaces and workforces that are culturally responsive, trauma-informed, resilience building, and supportive of mental health. As Sean said, we've been supporting various agencies in Michigan on this mission, and we've been working quite closely with the Detroit Public Workforce Development System over the last 2 years, and we're going into a third year working with them. So today, for just about 20 minutes, I would love to talk with you about what is trauma, what might be signs of trauma in our workplaces, what can you do in the moment if a colleague or a customer is experiencing trauma, re-triggering or triggering? And how can we cultivate more trauma-informed and resilience-building workplaces? So there's nothing better when you're talking about trauma than to start with a cartoon. And this one really captures, I think, what could be happening in workplaces when people might experience trauma triggering or re-triggering. So many folks, in fact, in our workplaces and in our society have past traumas. Add on to that the pandemic, work stress, all the bad news that we read in the newspapers, and it just gets piled on. And then maybe at work, there's a minor inconvenience, like maybe, hopefully not, the computer shuts down in the middle of you doing a webinar. And it's not that big of a crisis, but because an individual may be carrying those past traumas and those past stressors, it becomes too much, and it's the straw that broke the camel's back. And if the colleagues and supervisors in your workplace are not aware of these potential challenges, they may not be as sensitive to or have a good, healthy reaction to that inconvenience or the minor stress that you experience in the workplace. So what we're trying to do here is to help folks understand those big boulders that many of us are carrying around and to be more sensitive and responsive in healthy ways to those stressors and to the workplace. So I wanted to cover real quickly the definition of trauma, so that way we're all on the same page, because a lot of people like to use this word a lot, and sometimes it's overused and used for things that don't really describe trauma. So trauma is an event, series of events, or set of circumstances that is experienced by an individual. So it really has to do with the individual and their own experiences based on their context, their chemical makeup, their biological makeup, and how they're going to experience that event or that series of events, because it will vary by individual. So an individual experiences it as physically or emotionally harmful or life-threatening. And that's an important part. So that minor inconvenience may trigger an individual's brain to see that event as life-threatening. And it has lasting adverse effects on an individual's functioning and mental, physical, social, emotional, and well-being. So trauma is different from stress, and we'll talk about that in just a moment. Wanted to talk about the prevalence of trauma, and this was just one study in Philadelphia a few years ago that looked at adverse childhood experiences, which is one type of trauma in addition to PTSD or racial trauma or the climate trauma that we're seeing. And the study found that 70% of adults in Philadelphia had experienced at least one adverse childhood experience, which is adverse experiences before the age of 18, such as abuse or neglect. And 40% had experienced 4 or more. So trauma is way more prevalent than most people assume. And if you have had these experiences, as Sean said, you are definitely not alone. So the differences between stress and trauma, just to make sure folks understand this, is that some stress can actually be positive. Maybe a deadline to submit a paper or a report. It gets you focused on what you need to be doing. It ensures that you are able to have the mental ability to really focus on that and get the deadline or the report finished. It has an endpoint. It's not harmful to our mental or physical selves. Tolerable stress is a little bit more stress, but it's still manageable. And so this may be if you have a colleague who has gone out on a sick leave or an extended medical leave and you're covering for them. It's a little stressful, a little bit more work, but we can manage it and it has a point. Toxic stress is when the stress doesn't let up and we continue to feel it, as in chronic stress. And toxic stress starts to get us into that point where we are having physical and mental harmful reactions to that stress. So we may be not able to sleep at night. We may be so anxious that we can't concentrate on our work. We may be afraid of our boss, and so we avoid them. That's when we're getting into toxic stress. And then finally, traumatic stress, which gets into trauma and PTSD, is when those symptoms don't let up, when we become hypervigilant and it's actually starting to interfere with our ability to function on a day-to-day basis. It hurts the relationships that we have at work. It harms our ability to do our work. So just wanted to make sure that people are using the right terms for the right levels of stress and trauma and not overusing the word trauma. So how might trauma show up at work? Well, you've probably all heard the classic symptoms of trauma and reactions, which are fight, flight, freeze, and submit, or some people use the word fawn here for submit. They mean the same thing. And so you may be seeing somebody at work who is stressed out or maybe is reacting to a trauma that you don't know about. And maybe their response is fight. So they're lashing out, they're having angry outbursts. They may be expressing violence towards themselves or others. Instead of seeing that person as a jerk, you might stop and think, I wonder if that person has experienced some toxic stress from work or from home, or maybe in that person's background, they have some adverse childhood experiences or some other trauma in their life that is causing them to have this reaction. Other people might have the reaction of flight, which looks like avoiding of emotion, people, or places, the inability to really focus, and really difficult in trusting and forming healthy relationships at work. Some people may have the freeze response, where they have brain fog, anxiety. I think anxiety is one of the biggest mental health conditions that we see in workplaces now. And it's really because individuals are reacting to that toxic stress or possibly trauma, and it is causing their brains to freeze up. And then submit may look like depression, easily giving up, just having a whatever attitude. This is what quiet quitting looks like when people talk about that term. But trauma also has effects on our bodies, and this is how it shows up in our bodies in terms of physical weathering. And this was a term that was introduced by Arlene Germanis many years ago, and she actually just has a new book out this year looking further at this concept. But basically, when we're experiencing trauma, and the triggering of the reaction to that, our bodies produce a lot of adrenaline and cortisol, which are the stress hormones. And that is good because it enables us to run fast, fight hard, focus on getting away from the threat that we're facing. But our bodies are not designed to have those stress hormones flowing all the time. And so when they are flowing through our bodies constantly or often, they're wearing down our bodily systems, such as our immune system. It's harder on our organs. It's harder on everything. And so that actually prematurely ages us when we have those hormones flowing. So not only is it important to address and reduce toxic stress and trauma from a mental health perspective, but it's also critical from a physical health perspective. So just wanted to share a little bit of data on how trauma is related to employment. One study, again, on adverse childhood experiences, because this is where we have quite a bit of data actually, indicates that there are greater issues with worker performance with the increased number of adverse childhood experiences that somebody may have. So the study found that individuals with 2 adverse childhood experiences, again, abuse, neglect, parental divorce, poverty, substance use in the family, they're 1.5 times more likely to have problems on their job, 1.4 times more likely to be absent from work, 1.8 times more likely to have financial problems. And as the number of ACEs increases, so does the risk factors for these employment challenges. Now, these are not guarantees, certainly, because trauma can be counterbalanced with resilience. And so if we have more resilience factors in our lives, then we can reduce those negative risk factors due to trauma. And I'm not going to go into this whole framework in depth, but just wanted to point out that resilience, a lot of times people think it means bounce back, get over it, and it's a personal thing for the individual. But the way that we define resilience is more of surviving a adverse event and coming out on the other side stronger to be able to manage additional adversities. And at the core of resilience is safety. Individuals need to feel physically, psychologically, emotionally safe and valued in order to be able to have healthy mental health and build resilience to be stronger when they do face adversities such as toxic stress and trauma. There's personal strategies that we can adopt to build our resilience, but there's also organizational strategies and responsibilities in our workplaces that we need to be cultivating in order to build resilience. And there are also community strategies that should be implemented in order to have a resilient community, agencies, and individuals. So I wanted to talk a little bit about a model that can help you if you are experiencing a colleague or a customer or yourself even being triggered or re-triggered by trauma in the moment. So let's say, somebody comes into your office and they are screaming and yelling and they're very angry and they're saying that they're going to try to get you fired because you really did something to them that they didn't like. And so you're like, whoa, what do I do? Instead of getting angry and starting to fight back, assume that this is their fight response to a toxic stress in the workplace or at home or a trauma that they've experienced or a trauma retriggering that they have experienced. And the first step is to listen and address for distress or harm. So just really listen actively to the individual, assess whether they are trying to harm themselves or anybody else, get help if needed. But really that's why I showed the resilience model before. You really have to go back to safety and ensuring that the individual feels safe. So maybe that they need to get out of the office for a minute and go walk around the block because, kind of just process and metabolize that stress physically. Offer them a glass of water, offer to have them sit down and calm down. This is where those breathing exercises help out a lot because you can actually hack into your physical body with breathing, long breaths in and out to calm the brain down in order to be able to help this individual ground themselves and then move on to the next step. So once we've gotten to a point of safety with this individual, it's really important to affirm their experience. And this is the easiest thing in the world to do. Basically, you just need to mirror what they are saying. So, if they're saying, the way that you handled that report and the meeting on presenting the report, and I felt like you really talked down to me. So your response would be, I hear that you feel like I talked down to you in that meeting when we were presenting on that report. So that's just affirming their experience, making sure they feel heard, making sure they feel valued. Also, you can affirm folks' experience by just recognizing that, this is a difficult situation that you're undergoing. It may be difficult to manage. Or I appreciate you being here and coming in to my office to talk with me about that. That's something that's very healthy for both of us. So just affirming their experience. Partnering with them to determine next steps. So then once you've got folks grounded, feeling safe, feeling calm, feeling affirmed, then we can move on to the next steps. And so that would be, well, should we have a conversation about how I felt we did in that meeting versus how you felt? Should we talk about the report? Should we ask our colleagues what their experience was in the meeting? Should we redo the report? Whatever the situation is, you can start to get on with the next steps. And then if the individual who has experienced this is actually showing more and more signs, it might be time to initiate a self-care and support plan for that individual and to seek out professional help as needed. And that could be through an employee assistance program. It could be through national hotlines such as 988, the Suicide Crisis Lifeline, et cetera. So I want to share with you in a moment resources that outline this model. So you can click on a link and see more in depth how to use this model. The second framework I just want to pop up here is SAMHSA's 6 key principles for a trauma-informed organization. And if you want to move your workplace, your organization towards being more trauma-informed, I would suggest looking at this model, these 6 key principles, and having a team discussion with your team, with the whole organization, around where do you see these principles in action in your organization now? And how could these principles be implemented in your organization more to become more trauma informed and resilience building? And you can think of technical and cultural implementation strategies. And again, the resource here, which is CSW's set of quick guides, goes into both of the last 2 models I just shared more in depth in these guides. So you can scan on that QR code and get access to these guides, and they will help walk you through more detail how to use those 2 tools. Here's another resource, which is a couple of years old at this point, but it's basically a document that shares a little bit more about the definition of trauma and some examples of employers and workforce development organizations that have implemented trauma-informed approaches. And then, of course, we have the Workplace and Mental Health report that the Michigan Department of Labor and Economic Opportunity released. So here's my contact information, and I just wanted to see if anybody had any questions. Thanks for having me today.
Awesome, Vickie. Thank you so much. First question, one of the ones you would expect, right, is will you be sending out the presentation after the webinar? And of course, the answer is yes. That'll go out with the recap and everything else that we do. This is recorded as well and will be posted on our website as well. And then, so Vickie, I had a couple of questions for you. So we talk about resiliency too. So we're out there talking a lot, as you know, and thank you so much for sharing the information that we put out there and sharing links to our webinars and everything else that we're trying to do to make sure that we spread the word and spread this message. And when we talk about resiliency, as you mentioned, there's definitely the individual aspect of that, right? So we use the word resiliency and you always think about the individual. But one of the things I share with employers is that it's really a system issue. That, you know, I can learn or I can teach someone to be more resilient, but if I maintain the conditions that are causing the trauma, we're not really going to move forward. Can you speak to that a little bit?
Yeah, that's exactly right, Sean. And in fact, I don't really like to do trainings or have conversations with individuals about resilience building strategies for themselves unless I know the organization is also going to cooperate and start to work towards a culture of resilience building. And so in the guides, we talk about some more specific strategies that organizations can adopt to be more trauma-informed and resilience building. But I just wanted to go back to the graphic and say that adopting resilience building strategies and practices isn't rocket science. It's basically following those 6 key principles of ensuring that your staff feel physically safe. So is the lighting in the parking lot appropriate and on and working? Are there clear exits in the building so that way staff and customers, if there's an emergency, can get out? So those are sort of technical examples. But cultural examples are things like, do we have communication and transparency at this organization? When information comes down from leadership, has it been shared in multiple ways? Email, written documentation, through a staff meeting, through a Teams announcement. So that way there's transparency that communication is getting to individuals in multiple ways. Are we listening to our workers? Do workers have voice and choice in the way that they do their work? That helps them feel valued and it makes them feel like they are part of the team. So these are really just good job quality strategies in addition to being trauma informed.
And I like that community piece as well, because I was actually just thinking the other day about adverse childhood experiences and sort of what I've learned and what you've talked about as far as you carry that with you potentially forever, and you might have to relearn how to respond to stress because you've changed. It's changed the way that your body's going to respond to stresses at different points. And thinking about that community piece, that, there's certainly a lot of discussion about how we help people after the problem, and really focusing in on that. Let's not get to the problem. Like, we know we can't get to zero, right? You could try, but we know that. But let's get to the problem. And adverse childhood experience is sort of a quicker example that people comprehend. Like, you had a rough childhood in a lot of different ways. People get that, but that trauma can come from a lot of places. And as we did in June, we talked about, what if that trauma is coming from work itself, like state police, firefighters, healthcare workers, or something that happens at work. So I just talked with an employer maybe yesterday about a worker had committed suicide and the trauma that that was having on the people in their workplace. Vickie, can you, obviously that happens, right? And we have to learn how to deal with that. So that would be a system thought.
Yeah, absolutely. And the report from the American Psychological Association just came out a couple of weeks ago that a full 20% of Americans in this country feel that they work in a toxic workplace. So we've got some work to do around the organizational piece. And Sean, you're right, with the community resilience slice of this rainbow, we're not only by creating resilient communities, we're helping to prevent adverse childhood experiences, but also helping to provide more support for individuals who have experienced those traumas as well as other traumas. I know that there's been so much in the news lately about all the more violent storms that we've been having. So there's definitely climate change trauma that staff may be experiencing, as well as other traumas. And so it's really, we don't check that trauma at the door when we walk into work. It comes in with us, and trauma can have a very long tail. And so we all just need to be more aware of that, more sensitive to that, and provide more grace with each other.
And it's generational. You're going to pass it along potentially if you're not aware of it. And even if you are aware of it, you may do it inadvertently. So one of the questions was about Vickie's affiliation. She's with the Corporation for Skilled Workforce. It's a Michigan-based nonprofit that works in this area. You find all of her content. Oh, she's going to put it up on the screen for if Michael pans over. Find all of her information there. Great group. That we work with quite a lot on a lot of different issues affecting our workforce, including workforce development. They work with the Detroit area workforce development agency for a while and are doing some things there too. So I think the question was, might be interested in doing a presentation to a full division. I think there's Vickie's contact info, grab that, and it'll be in the recap as well. You can reach out to Vickie, but I'm going to assume the answer is absolutely, but yeah, definitely reach out to Vickie and then sort that out. And then Erica, if you don't mind, I'll just ask the question while I'm waxing poetic. How do you handle absences in relation to the trauma?
So when somebody is experiencing trauma and they're absent from work?
Yeah, I believe so, yes.
Okay, yeah. So this is what being trauma informed is all about, providing folks who have experienced trauma with the space to be able to get back to a place where they're feeling safe, providing a supportive emails, phone calls, text messages to make sure that they know that they're supported by their employer. This is why it's important to make sure that everybody in the organization knows at least the basics of the brain science of trauma, so that the individual experiencing the trauma understands that they might be having a reaction to a trauma that they've experienced, either as a kid or currently. They're being triggered, and they know how to bring themselves back to a grounded point. And so if they understand the brain science, they can work on their own physical regulation and mental regulation. You as an employer can help them with that. And the idea is, people can't be away from work forever. And so being trauma informed also means working with the individual to help bring them back to work and doing their work in a way that they can manage. So maybe they do need to come back part-time, starting off, so that way as they are recalibrating themselves, as they are getting adjusted to that trauma reaction, they can work on that while they are starting to integrate work back into their lives. So it's a matter of having that grace, providing that space, but helping people heal from the trauma and begin to build their resilience as well.
Thank you, Vickie. I think if you go back to our original webinar back from June of last year, it should be on our Leo Mental Health YouTube channel. We have a channel there for all the videos we've done. Vickie does a great segment on brain science. And I think when we're talking about trauma in that experience, when you re-trigger that trauma, you're re-triggering all the stress that went along with that trauma. So that person is having what we talk about in brain science is the stress response. And what happens when you have that stress response, that's what's happening. So you're going to get that brain fog, that confusion, the prefrontal cortex is going to shut down, and they're not mentally able to move forward. Not that they don't want to, it's that their brain's not operating in a way that allows them to move forward because the logic center is not leading the way. So if you want to look back at that stuff, we're working with Vickie too to kind of put some brain science things together and some other pieces, because when we're talking about having experienced that trauma and it's re-triggered, it's that stress response basically reactivated and you are right back where you were when that trauma occurred, and it's very hard to get back out of. So that trauma-informed workplace is just critical. Vickie, thank you again so much. You've been such a great asset to me individually, as well as our department and the people of the state of Michigan, for your continued support for our efforts and providing these types of educational opportunities, as well as pointing us in the right direction a lot of the time. So just thank you so much for your presentation today. Thank you all for joining us, and we look forward to seeing you on our next webinar.